Good afternoon. My name is Dr. Olga Divakova, and I'm going to present the following abstract: a rapid systematic review of postpartum bladder care guidelines and recommendations in the context of the COVID-19 pandemic. This abstract was written by a chorus group which is aiming at setting research and clinical practice standards. Chorus Group is currently working on COVID-19 adaptations and optimizations of clinical practice. This is my disclosure slide. Obstetric care has been significantly affected by the COVID-19 pandemic due to shortened hospital stay and early discharges, aiming to reduce risks of coronavirus transmission in the hospital setting. New pathways on the management of postpartum void and dysfunction and postpartum urinary retention are essential for prevention of long-term urinary tract sequelae. Our rapid systematic review aimed to identify relevant national and international guidelines and also summarize available recommendations on postpartum bladder care that are relevant to women's care and management at the time of the COVID-19 pandemic. We searched Medline, Embase, and Cochrane databases from inception to December 2020. We also did a hand searching of national and international specialist societies websites like AYUGA, RCOG, American Urological Association, ACOG, ICS, Royal Australian and New Zealand College of Obstetricians and Gynecologists, and Society of Obstetricians and Gynecologists of Canada. You can see a prisma diagram on this slide. We identified 41 records through database searching and additional 7 records through hand searching of specialist societies. After removing the duplicates and excluding some full text articles, we included 4 guidelines and recommendations. Results. We identified 1 international technical consultation on postpartum and postnatal care published by World Health Organization in 2008. There was 1 international society recommendation on urinary retention after childbirth written by ICS in 2012. There were 2 national guidelines, one of them NICE guideline on postnatal care up to 8 weeks after birth, published in 2006, and there is a guideline on management of urinary retention in pregnancy, postpartum, and after gynecological surgeries, published by Institute of Obstetricians and Gynecologists along with the Royal College of Physicians of Ireland in 2018. 17 recommendations were identified and arranged into 3 clinical domains. There was only 1 recommendation about diagnosis of postpartum void and dysfunction. 4 recommendations were related to the timing of the first void. And 12 recommendations provided information on management of postpartum urinary retention. All 4 guidelines and recommendations declared that the first urine void should be documented that has occurred within 6 hours after delivery or catheter removals. This aims to prevent from bladder overdistension. One guideline suggested that healthcare professionals should be alerted after 4 hours of not passing urine, which is very crucial, as this will provide time to try conservative measures with no pressure on the patient. The amount of post-void residual volume, which is considered to be significant, varied across different guidelines. Different authors used a cutoff of 100 and 150 mL, depending on the individual maternity units. As the cutoff of 150 mL is commonly used with no reported adverse outcomes, we suggested that it could be beneficial to adopt this instead of 100 mils. This can reduce the number of women staying in the hospital. The ICS and Institute of Obstetricians and Gynecologists in Ireland declared that there has been no consensus on the length of time that the catheter should stay in place. There were suggestions by ICS that the timing could vary between 12 hours to 2 weeks depending on the amount of post-void residual volume. 24 hours was mentioned as the minimal time by the Institution of Obstetricians and Gynecologists in Ireland. The ICS emphasized that clean intermittent self-catheterization could be a good option for managing postpartum urinary retention as it allows bladder to follow its normal filling emptying cycle. There are lots of advantages of ISC over indwelling catheterization, which are essential during the COVID-19 pandemic. ISC facilitates early discharge and self-management. There is no need for repeat hospital attendances as patients don't have to come back for a trial without a catheter. It can be managed remotely with the help of telemedicine, and community-based approach can be implemented if patients require further help and education. Conclusions. During coronavirus pandemic, there is striving towards self-care, community-based and remote care. Early recognition of postpartum urinary retention prevents long-term urinary tract dysfunction and reduces hospital stay. Clean intermittent self-catheterization for treating PPUR can be widely adopted due to its advantages. Thank you.